In this video, you will come to know about the risk factors and complications of PCOS. Risk factors of PCOS. Family history is one of the risk factors of PCOS. PCOS may run in families. In other words, you may be more likely to get PCOS if your grandmother, mother, sister, or the female relative has the condition. Although these connections are not fully understood, PCOS can be passed from one generation to the next due to hormone imbalance and other genetic factors. A woman's chance of developing PCOS may also be higher if her family has a history of type 2 diabetes. Obesity is another risk factor of PCOS. So many women with PCOS are known to be overweight or obese, and obesity is thought to be a major factor in the development of the illness. Adipose tissue in obese people releases increased levels of non-steroid fatty acids, cholesterol, hormones, and pro-inflammatory cytokinins that may contribute to the development of insulin resistance. Because of this insulin resistance, the body's glucose levels rise, which triggers an increase in insulin production, which in turn triggers an increase in androgen production, leading to the onset of PCOS. Eating habits. Avoid fried oil in fast food meals. Saturated fat can be found in many high-fat foods, including pizza, baked goods, and fried dishes. Consuming excessive amounts of fat might increase your calorie intake and make you gain weight, leading to obesity, which is one of the risk factors for PCOS. So here comes the complications of PCOS. Type 2 diabetes. Women with PCOS frequently have insulin resistance, which increases the risk of type 2 diabetes even if their body can produce insulin. Another complication of PCOS is sleep apnea. Obstructive sleep apnea has an unusually high prevalence in PCOS according to recent findings. The high prevalence of obstructive sleep apnea in PCOS may be related to changes in sex steroids, high androgen or estrogen levels, for example, and increased visual obesity. Infertility is another common complication of PCOS. The hormone imbalance in PCOS patients prevents the development and release of eggs from the ovaries. You cannot become pregnant if you do not ovulate. Abnormal uterus breathing is another complication of PCOS. The most active form of estrogen estradiol can be created by the body when significant quantities of testosterone are present. Endometrial cancer is more likely to occur in women with PCOS who also have high estrogen levels and excessive menstrual bleeding. Depression. Inflammation all over the body is also linked to PCOS. Long-lasting inflammation is linked to high cortisol levels, which raise stress and depression levels. Additionally, high cortisol levels raise the possibility of developing insulin resistance, which can lead to depression. Another complication of PCOS is heart attack. Women with PCOS frequently experience elevated cholesterol, high blood pressure, elevated insulin levels, and glucose intolerance, all of which raise the risk of developing diabetes and heart disease in those who are affected. Endometrial hyperplasia is another complication of PCOS. The prolonged exposure of the endometrium to uncontrolled estrogen brought on by an evolution, which means egg tone released from the ovary during your menstrual cycle in PCOS, is a primary factor contributing to the risk of endometrial cancer. Breast cancer. Non-risk factors for breast cancer including obesity, diabetes, hormonal imbalances, and infertility. PCOS will contribute to the development of these risk factors. Thanks for watching the video. Do subscribe my channel or leave a comment so I come to know from where you are watching my video.